The risk assessment of lead. What is lead substance? Lead is a metal, a transition metal to be exact. Now on to the uses of lead. Lead is used in car batteries, ammunition, to store corrosive liquids, and make industrial paint, for example, the paint you see on cars. However, it is banned for consumer use, meaning you cannot use this type of paint in the home. It is also found in pipes, plumbing materials, old toys, jewelry, fishing tackle, dyes, cosmetics, and much more. There's also a diagram to the left that you can look at. The routes of exposure. It's most common through ingestion and inhalation. Young children are at risk for ingestion by touching contaminated soil, older playground equipment, and then touching their mouths. Babies are at risk for ingestion because they often touch random things and then stick their hands in their mouths as well. It has been found in drinking water, which then can be ingested because of corrosion of plumbing materials. In 2011, there were changes to the Safe Drinking Water Act, which reduced the maximum allowable lead content in order to reduce the amount of contaminated drinking water. Inhalation from dust is also quite easy if one lives in an older home where the dust contains lead. On to absorption, distribution, and excretion of lead. Inorganic lead is absorbed in the body. Organic lead compounds, however, can be metabolized in the liver, and it is excreted through urine and in the feces. The half-life of lead varies from about 1 month in blood to 1.5 months in soft tissues and to about 25 to 30 years in bone. Children are more at risk in general because their growing bodies absorb more lead than adult bodies do. Lead can accumulate in bodies over time as it is stored with calcium. This can then be distributed to fetuses and pregnant women because lead is released from a mother's bones along with calcium, or expose infants that are being breastfed. The hazard assessment of lead. Lead can affect almost every organ and system in the human body. Rare cases can even result in seizures, coma, and possibly death. Adult exposure can lead to cardiovascular effects such as increased blood pressure and incidence of hypertension, decreased kidney function, and reproductive problems in both men and women. Children's brains and nervous systems are far more sensitive to lead than adults. Even low levels can cause behavioral and learning problems, lower IQ, hyperactivity, slowed growth, hearing problems, and anemia. Developing fetuses and/or infants that are exposed can be born too early or too small, hurt the developing brain, kidneys, and nervous system, and also put mothers at risk for miscarriage. The standard levels for safe use. As far as water goes, the Safe Drinking Water Act decided that a lead-free is a weighted average of 0.25% calculated across the wetted surfaces of pipes, pipe fittings, etc., and 0.2% for solder and flux. OSHA set a permissible exposure limit, or a PEL, for lead in workspace air of 50 micrograms per cubic meter over 8-hour time weighted average. EPA allows 10 micrograms of lead in dust per square foot for floor dust and 100 micrograms per square foot for windowsill dust. Lastly, replacement chemicals. Ethanol, isobutanol, TAME, TAEE, ETBE, and trimethylpentane can all be combined or blended with unleaded gasoline for use of replacement of lead-based antinox compounds. Thank you for listening to my presentation over lead.